Number 1, early diagnosis and treatment of Alzheimer's disease. Alzheimer's disease, the brain-robbing ailment that has no approved medication to slow, reverse, or arrest disease progress, is now a major global healthcare concern. Approximately 44 million people worldwide have clinical Alzheimer's, and millions more have even earlier forms of the brain process that places them at high risk for progression to clinical Alzheimer's. Early detection of Alzheimer's before symptoms are present is a major international research focus, since this would pave the way for early intervention, which provides the greatest chance of halting or reversing disease progression. Tau neurofibrillary tangles are one of the 2 hallmark pathologies contributing to the development of Alzheimer's. Beta amyloid plaques are the other, and tau is laid down in the brain many years before symptoms of cognitive decline are even present. Thanks to the recent advent of tau PET imaging, researchers are seeing tau for the first time in the living brain. This ability to track beta amyloid and now tau will allow doctors to intervene years earlier, particularly with those at risk before there are overt signs of dementia. Drug discovery is a long, arduous process, but thanks to the recent work of 2 brain researchers, there is now a way to significantly speed up drug discovery for Alzheimer's without the use of mice, which are the traditional experimental models. This breakthrough technology, dubbed Alzheimer's in a dish, can help researchers go from the testing of a handful of drugs in mice over the course of a year to the testing of hundreds of thousands of drugs in a matter of months, making drug screening for Alzheimer's disease 10 times faster and 10 times cheaper than testing with mouse models. When it comes to Alzheimer's drugs in the pipeline, the good news is that there is an experimental Alzheimer's disease vaccine that has excited the international research community. In early human trials, aducanumab, a human monoclonal antibody, significantly reduced amyloid plaque buildup in the brain and slowed cognitive decline by more than 70% in some patients receiving the highest drug dose. The world anxiously awaits phase 3 trials for the drug, which will begin later this year.
We probably should have had a drum roll before number 1, but you saw Dennis Selkoe sitting in seat number 1, so that might have been a bit of a giveaway. I also want to say that I know what you're thinking. You're saying, wait a minute, Alzheimer's is number 1 and Tanzi is one of the co-moderators. We did have about, 25 or 30 people vote on 50 different topics, and it did actually win. So picking up on yesterday's panel on Alzheimer's, Dennis, aducanumab, if it works, and it has the words "you can" in the middle, so we're hoping it will work, how do you envisage the future treatment and prevention of AD with a drug that hits amyloid like aducanumab or other similar types of therapies?
Yeah. So I think that particular antibody or another antibody or a small molecule that really slows the neurodegenerative process, and we can show it with biomarkers, and leads to cognitive stabilization is going to be transformative. And there are at least 4 ways that this is really going to matter to society. Obviously, most importantly, it's going to matter to patients. Surveys show that fear of Alzheimer's is one of the great concerns for people as they get older, and believe that it's going to most rob them of their human qualities, even compared to other terrible diseases. Second, it will put Alzheimer's into the paradigm with other chronic diseases like heart disease, and cancer, and suggest that we need to survey individuals fairly early in life, maybe in their 50s or 60s, to see if they have risk factors so they can go on a drug like that is shown to be efficacious and safe. Third, there should be powerful pharmacoeconomic implications. We assume that if you can slow down Alzheimer's disease substantially, less people come into the advanced stages. Within 2 years or 3 years of using such a drug or an antibody, there should be real benefit to the healthcare system. And fourth, a rising tide lifts all boats. And that is, this has enormous importance, immunotherapy in Alzheimer's disease, for doing this in Parkinson's and other neurodegenerative diseases. So we're really going to open up the floodgates of therapeutic work if this particular agent or others like it work.
So amyloid, as we mentioned yesterday, is kicking off the disease, lighting the match, so to speak. You have tangles spreading through the brain. You have inflammation really wreaking havoc. How are we going to treat these other pathologies, and what would a cocktail look like in the future for this disease?
So for some individuals, if we really succeed in our idea of treating very early or pre-symptomatically, we might not need a full cocktail. We might be able to get away with one agent, and right now the genetic evidence, the biomarker evidence, the clinical trial evidence that we've heard recently suggests that amyloid beta protein buildup, especially oligomers, might be enough to target very early on. But it's also terribly important to target tau. Number one, tau causes separate diseases that are not Alzheimer's, that don't have amyloid. And so I think tau immunotherapy or small molecule agents that change tau aggregation would be very important. And inflammation is the very hot topic in the Alzheimer field. So we imagine that regulating inflammation through some of the genes that have been discovered to cause late onset forms of Alzheimer's will be very important.